Hi guys, I'm Dr. Chloe Costigan.
And I'm Dr. John.
Today we want to talk to you guys about foam rolling.
So we figured first, before we tell you how to foam roll, we should cover what kind of foam roller would be right for you.
This is a question that we're asked pretty regularly because not all foam rollers are created equally. So we wanted to go over first what you are not looking for, and then we'll talk about what you are looking for.
And sometimes it's less so what foam roller is good or bad, but what's best to start with, and then you could always add on afterwards. Chloe has an example of a foam roller we like, and she'll go over why. And then I have an example of one that we like less. It's not a bad foam roller, but it's not where you want to start.
Okay, so the reason why we like this foam roller is not necessarily because of any of this like texture on the outside. It's actually because it has this firm core through here, so then it's not going to like deform over time, but it's like somewhat soft on the outside, so then it will like help you to decrease the amount of pressure that you feel when you are rolling. So it's less about the texture, it's a little bit more about kind of finding this balance between some softness, but then also something that's not going to, get squished after a while.
It's a great starting point because if you have this foam roller, there isn't anything that you're experiencing that this would be too much for. You always start with this one, and then if you wanted to get into a medieval shaped foam roller, you always can, but if this is the only thing you have with all of the spikes and points, and you have like really bad IT band syndrome or really bad quad stiffness, this might just be too unapproachable and it'll cause you to just not want to use it at all. And you could always start with the more approachable foam roller. As the other foam roller becomes easier, you could always move into this one.
The other thing too that I'll say is that if you say like, oh, okay, with this one, I can do this for a little bit, it's not so bad. The thing though that's most important is first making sure that you can do the duration of foam rolling. If it's like a minute to 2 minutes, if you can really only bear for like 15 seconds or so, just roll through your quads once, that's not really the objective. You'd be better off than using something like this.
Yeah, the other thing that's important to keep in mind is even if you can spend 30 seconds to a minute because you're so strong-willed, even though it hurts so much, if you're bearing down so hard and like grimacing and in so much pain from this, that you're like just, contracting all your muscles while you're supposed to be relaxing them, that's also not good either. I always say if it looks like you're gonna pass out on a foam roller, it's probably too much.
To the other end of that, some of these foam rollers are really, really soft. So if you're not really feeling anything, then it's probably, it's either that, okay, there's no issue in that muscle at all, which, there's kind of always something you can find, so that's less likely, but it just means that it's a little too soft, so then you just have to go, up in terms of the density.